on a man or a small-breasted woman, you can combine working on the chest with working on the arm, doing it one side at a time. And that's a really nice way to work, because then you can really spread the chest key out into the arm. On a larger breasted woman, working on the arm is kind of going to take the place of working on the chest mostly. So here's how we do it on a man. So doing your palming, combining the chest and the arm, and really allowing yourself to stretch out this pectoral muscle with your palming. Coming down onto the meridian in the arm, remember that you want to be right on the midline of the biceps, which is often further around the top of the arm than you think it's going to be. And the forearm, much easier, and the hand, extremely easy. What I mean when I say that the biceps, the midline of the biceps is further towards the top of the arm. You can feel the line between the two muscles here, and then coming down onto the midline of the forearm. So, thumbing. Doing your shallow curve towards the side of the nipple, and then thumbing along the pectoral muscle, the front part of the deltoid, and coming to the midline of the biceps. So you see how I'm actually really having to go almost back towards myself here, but coming into a much flatter part of the arm for the forearm. Famously, finding the meridian means working into the groove between the two tendons that stick out when someone makes a fist, into the center of the palm and coming onto the middle finger. I would also strongly recommend trying the dragon's mouth on this meridian in the arm. It makes it a lot easier to work in between the two heads of the biceps. And it tends to keep the arm in place. Arms can be quite fiddly when they roll out of position. Obviously, you have to change to palming for the hand. And then you do exactly the same on the other side. But for a large-breasted woman, you'll have to miss out the chest bit, most of it. But I would urge you to try and contact, even with only a fingertip, this area right in the center of the breastbone. It's not an erogenous zone, really. It's more of an emotional one or a consciousness one. And then the next port of call is going to be the pectoral muscle. And getting a connection here is going to give you the feeling of the meridian. It's also going to really open up the chest. And then you would go down the arm as before. And do the same on the other side.